On December 8th, former Telangana Chief Minister K. Chandrashekar Rao underwent a successful total left hip replacement surgery at Yashoda Hospital in Hyderabad. The surgery became necessary after KCR fell at his residence, which caused a fracture on Thursday. Senior orthopedic surgeons, anesthesiologists, and nurses performed the surgery, and the hospital reported that KCR had a successful surgery. Following the surgery, he was moved to a room for recovery. The hospital expects a typical recovery period of 6 to 8 weeks for KCR, who is currently receiving post-operative care, including IV fluids, antibiotics, and pain medication. Plans for ambulation, physiotherapy, and nutrition will be designed based on Saturday's assessment. KCR had resigned as Telangana's Chief Minister on December 3rd and had been residing at his farmhouse in Erravalli near Hyderabad. Unfortunately, on December 7th, he fell in his bathroom, resulting in a hip fracture. Prime Minister Narendra Modi, Union Minister and State BJP President G. Kishan Reddy, Andhra Pradesh Chief Minister Y.S. Jagan Mohan Reddy, TDP Chief N. Chandrababu Naidu, and others expressed concern over KCR's injury and conveyed their wishes for his speedy recovery. Subscribe to Daily Salar Digital for more such updates.